Dr. Amen, you've looked at brain scans, and I know this is something our viewers have been very, very interested in learning, because this is something a lot of people struggle with. And you have pictures of a healthy brain and the brain of someone with an addiction. Obviously, they look very different. An addict's brain, as you can see, everyone on the right there has a lot of holes in it. For lack of a better term, it's damaged. Why does that brain that Robin Williams would have been suffering from, lead to depression and suicide?
Well, you know, we've done over 90,000 scans on people from 111 countries. So we have a lot of experience with that. And when your brain works right, you work right. And when your brain is troubled, you have trouble in your life. So a healthy scan, what we're looking at they're called SPECT, S-P-E-C-T scans. They look at blood flow and activity. Healthy scan, full, even, symmetrical activity. One that has suffered cocaine addiction, alcohol addiction, multiple addictions. What we see is overall low activity in the brain, and if it's low, you don't feel right. You don't feel joyful. You don't feel happy, and it can then affect your behavior in so many different ways.
And in addition to the fact that that he would have been suffering from the brain with the damaged brain that you talked about, an addict's brain, he also had gone through heart surgery. And you've done some studies in terms of what heart surgery would do to a brain, which looks very similar to the addict's brain there, so both the left and the right. So when you put those on top of each other, an addict's brain and a brain after heart surgery, as someone like Robin Williams may have been suffering from, what then happens to the state of that person's psyche?
So what it does is it even can decrease the activity in your brain further. And so you begin to see these stacked stresses from addiction, depression, heart problems, which go to blood vessel problems overall. So you have lower oxygen to your brain. So you don't think, and when you get depressed, it really becomes a thinking disorder, and can be devastating, especially if there's psychological or social triggers that end up triggering the behavior.